I did talk to Wayne County Executive Warren Evans, and he was talking about making sure that the data is actually correct when they're talking about the deaths that they're having in the county. And also he's talking about the budget in the county. Take a listen.
In the last few days, it's interesting, the number of new cases has leveled off significantly, which is promising to look at. But the people who have been in bad shape in the hospital for longer periods of time, I think, are expiring at a rate that is a little scary. So to be able to have a place for the bodies to get through this and give the hospitals the room to continue to do what they're doing is one of the really significant issues. One of the other ones is just getting accurate records so that when this is over, and God willing, it will be over and be over soon, we'll have the appropriate data to extrapolate from this. My not biggest fear, but one of my fears is that we lose information relative to the race of people, the information relative to what hospital they came from. I mean, all of that data is going to be really helpful for us to try to prepare if there's such a possible thing for the future. And we're getting better at the coordination to get it done, but it's still not perfect.
So let's go ahead and talk about that. What is your office doing to coordinate data that's happening county level, and then also coordinating it with the state? And who have you engaged into doing that?
Well, we've engaged the hospital. Hospitals. We've engaged our health department, and I brought in some data folks to help extrapolate information. What I noticed early on was we would see information like 34% of the deaths were African American, 24% of the deaths, just as it's roundabout for certain days, were Caucasian, and then you'd have 30% race unknown. Well, you're never going to make any sense out of that until you figure out what's going on with the race unknown. And so oftentimes it was the appropriate box wasn't filled out when it was submitted, and you could go back into the case notes and extrapolate that, but in some cases you can't. And so, we're just trying to make sure that we do all the follow-up we can so that at the end of this, there's actually real data to plan for the future.
Let's talk a little bit about, I think, the cases that people are watching are in the nursing homes, occurring in the nursing homes in Wayne County. What kind of communication have you had with the operators of some of the nursing homes in terms of either helping out the staff there with more PPE or more testing of residents of the nursing homes and the staff there as well?
Well, both of those are things that emergency preparedness, for example, with Wayne County has worked towards trying to get the PPEs necessary for first responders and all of those folks. And you kind of go down a checklist. I mean, we really didn't have a checklist necessarily for nursing homes, but clearly when we have enough inventory and when we had enough, we want to share it with everybody that needs it. So, that's one of the things. The other is our health department kind of giving some case follow-up and to look at nursing homes and just what protocols they have in place. What do they have in place to see if there's some way that we can assist them with social distancing issues and other sorts of things to the extent we can. So we're trying, and we know they're trying also.
Let's talk a little bit about the conversations that are already happening about, opening up the economy again. Do you think that we need to have those conversations? It's too early to have those conversations, or what would you like to see included, or what we have to take into consideration before we talk about that?
Well, I think the biggest thing is the issue of, and whether people want to admit it or not, they're balancing the need to get the economy going with the safety of people. And I don't think that's a balance. I think the science tells you when businesses can reopen, and not, I'm certainly a strong advocate for helping businesses, and we've been committed in a number of ways to doing that. But the reality is that we open too quick and start to have the numbers go up again. Actually, the long-term impact on business is going to be more significant than if we just kind of bite the inside of our lip and hold on until the healthcare professionals can give us a sign about going forward, and then it has to be staged. And so we should be planning to reopen now.